Hello there, and welcome back to my channel. I am back to answer your questions about mental health because I believe that this information should be easily accessible to everybody. And so today's question is, what is the difference between a therapist and a psychologist? Some of you may even be asking right now, like, wait a minute, I didn't even know that there was a difference. And yes, there is a difference and some similarities. And so let's go through those. So a therapist is more of a common umbrella term that many professionals fall under. For example, licensed clinical social workers are therapists or can be therapists. Licensed professional counselors can be therapists. Psychologists can be therapists. Licensed marriage and family therapists are therapists. And so it's kind of like an umbrella term, but there are differences between professionals in terms of their education and their training background as well. And so let's talk about therapists first. Master's level therapists, of course, have a master's degree. Again, they can have their master's in social work, psychology, counseling psychology, or just counseling, and even marriage and family therapy. And so, master's level therapists are educated and specifically trained to do therapy. Now, there may be other things that they do in their career as well, but as we are sticking to the topic of therapists, master's level therapists are trained to do therapy, and they are educated in that light as well. On the other hand, many psychologists are trained and educated to do therapy as well. However, a psychologist is a doctoral level position. And so psychologists either have a PhD, which is a doctor of philosophy, or a PsyD, which is a doctor of psychology. Being in a doctoral level program, of course, there's more education. Typically, that can range from 4 to 6 years. Some people even go longer than the 6 years, depending on how long it takes them to complete and defend their dissertation. And so, education-wise, a psychologist has more years of formal higher education, specifically in the field of psychology. Also, there's research with it as well because, of course, to have a doctoral level degree, you have to complete and defend a dissertation based on a topic of your choice or your interest. And by the time you defend your dissertation, you're considered an expert in that topic, which is pretty cool. And so research is a big part of a doctoral level program as a psychologist. Now, psychologists are also trained and educated to administer psychological testing. And so full batteries of neuropsychological testing, personality assessments, intellectual assessments, all go under the umbrella of being a psychologist. And typically, a master's level therapist cannot provide assessments. And so, for example, if you have a child who you are concerned with that they have or that they're showing signs of ADHD, and you want to get them like a full neuropsychological assessment, you couldn't go to a master's level therapist to obtain that. You would have to go to a psychologist because only a psychologist can administer like a full battery of assessments. For the question may be, maybe you're looking for a therapist and you're wondering, well, do I go to someone who's a master's level therapist or do I go to a psychologist? And to answer that question, it really depends on what you're looking for in terms of expertise, in terms of like your needs. And so let's say that you're struggling with some depression and anxiety and you're looking for a therapist, you can go to a licensed clinical social worker. You can go to a LPC, excuse me, which is a licensed professional counselor. You can go to really any therapist, whether they're a psychologist or whether they're a master's level therapist, to get what you need. And so it really depends on what they specialize in professionally, and it depends on what you're looking for. However, like I mentioned earlier, if you need some psychological testing done, your option would be to go to a psychologist, because a master's level therapist cannot provide that or cannot administer that. And so it really just depends on what you're looking for and what you need. And some people even ask, well, is a psychologist better than a master's level therapist because they have more training and education? And to answer that question, not necessarily. I would say no. It really just depends on the person that you're going to and the needs that you have. Because there are some amazing master's level therapists out there. Again, they are educated and trained to provide therapy, to provide quality therapy. And so it really depends on what you're looking for in a professional, and looking them up again on Psychology Today to see like what their credentials are, if you even care about that. But however, if you are just searching for therapy, like you need someone to talk to, you want to learn some coping mechanisms, you want to get through some things from your past, you want to work on some goals for the future, you can literally go to any therapist for that, depending on what they specialize in and what they provide. And so it's really all about what you are looking for. Otherwise, that I hope that answers the question of what's the difference between a therapist and a psychologist, whether you're looking for a therapist or whether you're thinking about becoming a therapist or a psychologist. And so don't forget to like, share, and subscribe for more of this content. Again, if you have any more questions, please put them in the comment section below, and I will be sure to get to your questions in my next video. See ya. Goodbye.